Good afternoon, everyone. This is Kathy Storr. We're going to get started in just a minute while we're waiting for everybody to join the call this afternoon. All right, good afternoon. Let's get started. Today's webinar is being recorded, or will be being recorded in just a minute, just to let all of you know. My name is Kathy Storr. I'm with Illinois Action for Children, and I am the project lead for the Consortium for Community Systems Development, which is a Race to the Top Early Learning Challenge initiative. It's a joint project of the Governor's Office of Early Childhood Development and Illinois Action for Children. And through the consortium, we're working to bring ideas, resources, and people together across the state in a lot of different ways, including webinars. Today's topic is on innovation zones, which is a really timely topic. I'm going to draw your attention, and you'll all get a link to this article that appeared in the Catalyst Chicago publication yesterday about the innovation zone. So perfect timing. But before we get started, I want to go over a few basics about webinars. Because of the large number of people that we have on the webinar, we have everyone's lines muted, and they're going to stay muted. But if you have questions or you'd like to offer a comment, there's a couple of ways to do so. You can raise your hand to ask a question. You have a nice little hand button, and we will call on you when there's a break in the conversation. You can also type your question and hit send, and we will get your question and answer as many as we are able to. If you're having any technical problems during the webinar, shoot Maya an email at the email address on your screen. As I said, we are recording today's webinar, and we'll post it. We will post it on our website following today's webinar. So one of the challenges, of course, with a webinar is that we can't see our participants. So we'd like to know a little bit about you before we get started, and also find out about what you already know about the Innovation Zone. So here's my first question. So watch it now. Okay. Instead of what part of the state are you from, what's the weather like where you are? Okay, and those of you that are answering warm and sunny, you're going to need to type me where you are. I'm going to stop this poll in just a minute. All right. Oh, look, 2/3 of us are in cool and rainy weather, and somebody has no idea what it's like outside. Whoever is where it's warm and sunny, let us know where you are, and I'll report that later. The other question I wanted to ask is how much you already know about the innovation zones. We're going to go through a lot of different topics today, and we'll just get a sense of how much you already know, and if you're part of one of the innovation zones. All right, I'm going to close this. We're having great voter participation, by the way. I can watch the voter participation. 96% of you just participated in this poll. Okay, so it looks like about 1 out of 5 of you really know nothing about the innovation zones, and almost half know a little, but not enough. Oh, good. We've got many of you who are in one of the innovation zones, and about 1/4 with a good amount of knowledge. So thank you very much. All right, in just a moment, I'm going to turn the webinar over to Leah Powell, who is the Director of Program Innovation at Illinois Action for Children. Leah has been at Illinois Action for Children for less than a year, but she's brought to our organization and to the field a wealth of knowledge and experience that's really supporting Illinois' efforts to devise and implement innovative solutions to what are truly vexing and complex problems within our early childhood system. Oops. After Leah speaks, she is going to call up to speak Lori Longville, who is the director of the CCR&R for the southern 15 counties in Illinois. She's out of John A. Logan Community College. And Lori is going to be telling us about the Innovation Zone in Williamson County. Janice Minster is the Race to the Top coordinator for Children's Home and Aid for the southern region, and she is intimately involved with the Greater East St. Louis Innovation Zone. So really happy to have all three of you join us for the webinar today. Thank you so much for taking time out of your day to do this. And with that, I am going to turn this over. Just give me a second. I'm going to turn this over to Leah. Leah, I'm going to make you the presenter, and in a minute you'll have the option to share your screen. And when you're ready, you can take over.
Okay. Is my screen? Can you see my screen?
We can see your screen.
Oh, good. Well, thanks everybody. I want to thank everybody for joining us today. Unfortunately, we are in one of the gray spaces of the state, but we're inside, so that's good for us. So I want to take some time just to go over, spend about 10 minutes talking about the innovation zones. I'm going to provide a overview of what we've been doing, both in terms of our planning process, how the planning is a little bit different, and why it is innovative, why we're using the word innovation for innovation zones. So it's not just bringing innovation into the communities, but we're looking to try a new process in terms of how we might be able to implement change and work to improve outcomes for kids. After that, we'll have highlights from Lori and then also from Janice, where they'll be able to share some in-depth work that their communities are doing, talking about the priority populations that they're looking to serve, some of the small wins, big wins, and then lessons that they've learned so far in their work. As Kathy mentioned, we have I'm here to present, and then we also have Lori and Janice. So this word cloud, I put this together to help give a picture of some of the ways that we think about our innovation zones in terms of these are words that kind of drive our work. So we have uncertainty, there's discovery, learning, science, community-driven, entrepreneur, build, measure, learn, innovation, art, looking at art of the start. So most people know that the innovation zones are helping the state to pilot test different strategies to increase engagement of children with high needs in high-quality early learning and development programs. Each innovation zone was selected based on level of concentrated need in their community. There was a presence of providers that had demonstrated interest in quality improvements, a history of collaboration among early education providers, and a strong local support for early learning. This work that we're doing is occurring at 2 levels with support from Illinois Action for Children in partnership with the Governor's Office of Early Childhood Development. On the local level, each community is working to implement specific opportunities that they've identified as the best solution to increase enrollment of high-need children in high-quality early learning and development programs. And then this work is also occurring at the state level to help inform how early childhood systems might shift policies to better increase access to high-quality early learning experiences. We're going through the process in 4 stages. Let me see if I can move the slide forward. Okay, so we're planning with innovation. The first stage that we've been working in is in discovery. As this is a community-driven process, each of the 7 innovation zones, which are in Aurora, Cicero, East St. Louis, North Lawndale, Pilsen and Little Village, Thornton Township, and Williamson County, they've worked together to bring stakeholders from their community to have discussions and talk about what they feel is the highest need and priority population in their community. The Early Learning Council All Families Served Subcommittee worked for the last year to develop a list of priority populations who are considered unserved. So they're at risk, they're underserved, they're challenging for programs to find, reach, or serve, and then they're populations where we can measure at both community and program level. The populations that meet those criteria are children of teen parents, children in homeless families, children in families of poverty or deep poverty, children in families who have DCFS involvement, children with disabilities, including those who are transitioning from early intervention to preschool or early childhood special education, children in family, friend, and neighbor care, linguistically isolated, and children of migrant or seasonal workers. And then we also have categories that have been added by local communities. And what we were doing with this process, so each of the communities looked at who is it in our community that's unique to the characteristics of our population that we find fit this criteria of being at risk and underserved. The next stage of the work that they did was the planning process. Through the planning, following discovery, they worked together again as a community to plan out a roadmap of how they might better serve this population. The tagline that we used for them was, if you could, what would it be? Really encouraging the innovation zones to think big, broadly, exploring and doing a root cause analysis, a deep analysis to think about what are the barriers that our families in our community have experienced time and again. Are there system changes? Are there program level changes? Are there ways that we could work together better as a community to help make a difference for families? What they did is they then came up with a logic model, which is their roadmap to help achieve a stated outcome. And then they're working to define those outcomes. So the outcomes that they're doing are looking at, can we improve enrollment and access for children, and then can we increase high-quality programs? Some of the themes that have come up from the innovation zones include looking at systems change, what we call the pipeline. So, for example, Aurora, East St. Louis, North Lawndale, and Pilsen and Little Village are looking at, and in Williamson too, are looking at pipelines. So how can we connect families, see where the families are currently at in the community, whether that's a homeless shelter, is that a food pantry, is it through developmental screening, our healthcare systems, human services systems, and can we then connect children and families into early learning and development programs, including home visiting programs, quality center-based care, preschool for all, Head Start, for example. Some of the other ideas that have come up have been innovations in parent engagement. So East St. Louis, Cicero, North Lawndale, Pilsen, and Little Village, again, Williamson County, and Aurora too. I mean, really, a lot of this work is going on in all the innovation zones, but how can we target recruitment and maybe specialized training for our parent ambassadors? We might recruit parent ambassadors who have children with special needs, or we might recruit Spanish-speaking parents to then go into the community and go door to door and try to engage families at a level that they understand, help them with advocacy, help them gain subject matter expertise in an area that they may not understand, help them to facilitate enrollment for children into some of these programs. And then we're also looking at quality improvement, so that's a really big one. How can we use innovative strategies to improve the pool of quality that we have in our community? So then as we're doing outreach and as we're building a pipeline to have more children come in through our programs, how do we make sure that those programs are of a high quality so that they're getting good access and quality at the same time? What they move into next after they do the planning process, they've moved into implementation phase, which is what all of the communities are working on right now. If you can imagine how one of the metaphors that we use is related to architecture. So when architects are building new projects, there's usually a big discovery process where you look at big ideas of what a building might look like, and then they go through to planning where they have blueprints, and then you start to do a work plan where you start to hire people out and get more detail and get more granular, and so that's the phase that the innovation zones are moving into right now. So as far as implementation and work plans, the communities are coming up with really much more detailed ideas about how we're going to do the work. So the logic model helps them think, what buckets of work do we need to do to accomplish our goal, and then more specifically, now who do we need on board to actually make the goals become a reality. The work that they're doing, for example, in Pilsen and Little Village related to parent engagement, they want to have partnership with Kofi parent ambassadors to do some work to help increase information for families as they transition from early intervention into special education systems. So how can the parents be advocates? How can the parents become more informed? But then through the meetings and through the work plan process, we realized that the community members who were at the Pilsen and Little Village Innovation Zone meeting, they also wanted to raise their own awareness and expertise in that area. They also thought that it's not just parents, but how can we all learn about the system? Who else needs to know? So they spent a lot of time thinking about the details of implementation. One of the big goals that we're trying to do with the innovation zones is to think about success in implementation. And so by having a community-driven process, we're really trying to look closely at, I guess, really have our ear to the ground for where barriers could come up, any space where the innovation zones might find that there's a lack of knowledge, then we can bring that knowledge in. They feel like there might be some sort of a barrier with the system. Maybe we have a conversation with, one of the players from the system. I keep calling it the system, but say, for example, in Pilsen and Little Village, we have CPS as a close partner in the work with us there. And we can just have a conversation with them to help us unpack some of the barriers that come up as we're moving forward. One of the goals for the Innovation Zones is to launch in August. We're trying to do something, again, innovative in terms of this build, measure, learn, which is that, they get started, and this comes from the Art of the Start, which I'll explain in a little bit, but this idea that you would, get started, have your great idea going, and then optimize it and make it better as you go along. So one of the themes that I mentioned was that there's a lot of uncertainty for high-need populations and at-risk families. They don't always end up in our data system. So we might have information through the census or through other data systems about who's currently being served, but our data systems don't show us who's currently being unserved or underserved. And so that puts a lot of uncertainty into our approaches. So the Innovation Zones have come up with some really good ideas, but there's always a chance that they might come up with some barriers as they're trying to engage families. And so we really want to allow them the opportunity to have that experience and to reboot if they have to. They call it pivot or persevere. So we're going to try to collect local data, program level data, so that we can see if the children who are entering new programs actually came in through the innovative approach. And then if we're finding that that's not the case, then we might, or what we're going to encourage and what we want to happen is for the innovative approach to then be adapted to work harder to bring more children in. The outcome for us is to keep our eye on the prize, is to serve more high-need children. And if that's not happening, we want to regroup and figure out what needs to be tweaked and then go back and keep trying. We don't want to stop at a number. We don't want to say that we're going to serve 50 more children, and then once we get to 50, then we're going to stop. We want to be able to keep going and serve as many children who are in need as we can. One of the things that we've also been doing in terms of looking at sustainability is some of the Innovation Zones have been partnering with either private foundations, the United Way, or we're working to help them have languages they can use in grants to help build out and support some of the work that they're already doing. Everything that we're trying to do with the Innovation Zones is to do it on a lean budget to kind of work within the system that we already have rather than adding on new things. Once the Race to the Top funds are over, we want this work in the community to be able to continue to go on. They're working so hard in that we want to build the energy around good collaboration work, good collective impact work, and then keep that moving forward. Right now we have an evaluation that is underway to help us understand what we're doing as we're going along. So the evaluation is both to help us kind of build, measure, learn as we go forward, and then also to help us understand the outcomes that we're working toward. So the evaluation in terms of our sustainability would be to make recommendations to the state about how and if the state might engage local communities to affect state systems change that might lead to increased program quality and enrollment of high-need children. So in other words, do investments by the state in building local systems lead to increased program quality and enrollment of high-need children? So because we're looking at this at two different levels, we want to ask, do local strategies, does a local intervention unique to our 7 Innovation Zone communities, does that increase enrollment in early learning and development programs, or does it increase the number of gold-rated programs? And then also, does investment in intensive, facilitated and focused technical assistance and planning to support local collaborations, does that result in more high-need children being enrolled in high-quality early learning and development programs? So those are some of our big evaluation questions that we're asking for this project. And then another part of our sustainability approach is really to look at this idea of implementation. So we use the active frameworks for implementation science. And what that allows us to do is to take the time to circle back and to touch base and to realign and make sure that we're asking the right questions as we're moving the work forward. So even though we have the opportunity for build, measure, learn, what we also want to do is make sure that we're on path, that we're aligned with the state's vision, that we're aligned with what Race to the Top is looking for from us, and then we're also aligned with what the evaluation is looking for. And so, we'll touch base every quarter or so to make sure that we're asking the right research question. Is our logic model working towards that right research question? Is our work plan working towards helping us to achieve those goals that we set out for ourselves? Is our approach feasible? Is our approach well-defined? Are our outcomes clear? have potential barriers been addressed? So we're going to find that sometimes there's barriers that are addressed, that come up right away, and then we'll address those. But then as we move forward in the work, new barriers are going to come up. Are the resources that we need in place for implementation? Are the resources that are in place for sustainability? Are our key stakeholders and champions engaged? Are they partners in the table? Are there more people that we need to engage? Can our partners help us bring more people to the table so that we really do have a diverse voice and a diverse representation of people who are participating in this community-based effort? What this is here is kind of the long picture. So we have, as I said, the discovery, planning, implementation, and sustainability. So it moves over 4 stages of work, with implementation being kind of the long vision, and then sustainability being really it overlays all of the work that we're doing. What we find is that each community is really unique, but we do have a roadmap for each one aligned to achieve these specific outcomes. And again, as I stated, the outcome would be to serve more high-need children being served in high-quality early learning and development programs. Some of the work that they do from an implementation team point of view is they just work so hard to increase buy-in and readiness from the stakeholders. They're working to engage the community and to generate interest in early learning, in innovation zone, in high-need kids, in high quality. So there's a lot of work and a lot of effort that goes around that. The innovation zone leads are working hard to execute and sustain the implementation process. So there's a lot of learning, a lot of professional development, and beginning to share amongst each other to talk about some of these small wins and successes that they've enjoyed and been able to experience with each other in each innovation zone. Our innovation zone teams will be working with our evaluation team and then also tracking changes that are needed in external systems to help support innovation implementation. So some of you have seen a presentation that I've done before. I spent a lot of time talking about a cascading logic model, which is really just a fancy way of saying that there's a lot of people who are involved. None of this work happens in a vacuum. So we're at the innovation zone level, which is kind of in the middle. But there are administrators and experts and leaders in policy and practice who are sort of above us, if you will. And then we have people who are in the community who at the very local level. So you kind of have the bigger picture all the way down to the local level. And then there's change and adaptation and communication that needs to happen through a feedback loop all the way throughout the process. And that's been a really important part of the work that we're doing with the innovation zones, helping to identify and flag opportunities for change. So sometimes those opportunities might be related to data sharing. Sometimes it might be about communication. Sometimes it might be something much bigger, a much bigger policy question that won't necessarily be answered overnight, but maybe by over the next couple of years, we'll keep working to have bigger policy questions brought up and answered. What we're trying to do with innovation zones through our feedback loop is have different channels so that the policy questions, the big policy questions, can be answered and addressed. And so we have the Early Learning Council as one of our channels for change, if you will. We also have through the governor's office, through conversations with the Governor's Office of Early Childhood Development, they have access with the interagency team and then some other opportunities through all the different state systems and committee meetings and things like that. We want to make sure that our innovation zone, the lessons that are learned from the work, actually get translated and communicated to all these other entities that are out there. This here is just kind of a big picture, a lot of pictures to give just a sense of how complicated this work is and fun and colorful, depending on your perspective. We use a lot of different theories and frameworks and concepts. These are some of them that help shape our thinking. The active implementation frameworks for program success is one of those. These feedback loops, that comes from the North Carolina Transformation Zone work. Behavioral economics is a big part of what we do. I have one of these slides, one of these pictures here. It says influence, and there's a little red book in the lower right-hand corner. So these are techniques and tactics for the innovation zone leads themselves to be able to help communicate change that they need to make and that they can help facilitate, helping people come to their meetings. I don't know, Power and Influence, these are some great books through the University of Chicago Business School and some of these MBA classes that they teach people in terms of leadership. And so how can we give that to our innovation zone leads to help them be more influential in the work that they're trying to make and trying to do. Getting Past No is a book on negotiation tactics and techniques, and so that's something that will be really useful on the local level when coming up against barriers. So one of the things that we're trying to do a little bit differently with innovation zones, both generally and specifically, is to look at like how can we approach work differently. So in the past, it might be that you would have a really good idea and then you would come up against a barrier and maybe create a workaround because the system isn't able to budge. But how can we work together to negotiate and keep working on the system and asking the system to make changes to help improve opportunities for children? We all have a shared vision for improved outcomes for kids, and so how can we work together to help make sure that that happens? One of the other things I'll say about kind of the traditional way, I like to call it the old way versus the new way. So the traditional way for a project like this, and this is in some ways actually how some of the other states are looking at their transformation zones, is that there's a long application process that's a top-down process. The scope of work is predefined, and then the local community has to fit their unique community identity into a predefined scope of work. Maybe there's limited local input. Again, maybe you have to create a workaround or modify your idea to make it fit into the system or make it fit into the application that's there. Failure can be very well defined. There's very strict rules and there's very strict guidance from a contract that communities have to follow. And what we're trying to do with innovation is that we are using a lean startup method. So we're getting started, again, recognizing that we're working with uncertainty, recognizing the reality that the data we have, again, doesn't reflect all of the children and all of the families because many of them are uncounted. And so it's a market-based, it's a on-the-ground market research is what's taking place, and that as you're learning from the community experience, you're actually able to adapt and optimize your program. Our approach, again, is community-driven. It's iterative. We're using the feedback loops, and we're really looking at system change. So how does this all fit in a big picture? So that our communities are not working in isolation, but they're actually part of a larger system and a larger conversation with all the players in the state. We also look at the getting to yes and getting past no. Failure, we put it in quotes, thinking about it as, there's really no such thing as failure, but there are just opportunities to learn. So maybe something didn't work out. Maybe you invited people to a meeting and they didn't show up, and that's okay. That's not a failure. That's just a do-over. Let's try that again, and let's try a different time of day. Let's try to see if we have this influential person in our community to come to the meeting as well, will that bring more people to come to our meeting? So just, thinking outside of the box and very entrepreneurial. This is an idea, a frame of mind to really encourage people to think creatively and to think outside of the box, to think cross-sector, and to use ideas from other systems to help inform the work that we're doing. And then this picture here is some of the, again, kind of these creative approaches, both in terms of our, what the innovation zones are doing on the local level. Some of it is in terms of our professional development that we're trying to be able to provide to the innovation zones to help them really lead this complicated work. So we have Second City that will be coming out to one of our meetings just to use a leadership and communication training, but to do it in a more fun, interactive, engaging way. One of the things that Second City is able to do and bring is how do you think on your feet when situations are changing, when you have a lot of instability and moving structures and moving pieces. These trainings from Second City can help all of our leads think more quickly. We've been using mind maps. We've been using World Cafe through the Art of Hosting. Thanks to Kathy for bringing that to a couple of our innovation zones. But some of these pictures, we've got people who sit around tables with colorful markers and Post-it notes, and it's really, really engaging. It's a very energizing process. The communities have responded so positively to the work, and they really appreciate being a part of this really rich conversation about how to serve more kids. These are some of the quotes that we use. It's kind of, there's a lot on here because there really is a lot that goes into thinking about innovation. The one in red that stands out is that ideas are easy, but implementation is hard. And so we put a lot of work into making implementation a little bit easier just because this process is very different. But as Einstein said, we can't solve our problems thinking with the same thinking we used when we created them. This other one that's on the bottom is kind of a favorite. So when you innovate, you've got to be prepared for everyone telling you that you're nuts. And as they always say, if it were easy, somebody would have done it already. But here we are. We're trying to do something different. We're trying to think outside of the box to really help these kids who are kids and families who really are in great need. So With that, that's kind of a lot. I know that I spoke quickly, but I want to give time for Lori to speak and also for Janice. So I'll just turn it over to Lori now.
Okay, can you hear me?
Yes.
Hello?
I can hear you, yeah.
Okay. Yes, we can hear you, Lori.
All right. So thank you for letting me speak today, and I'll try to make it as brief as possible, but I do want to make sure that you understand the context of how we're working in Southern Illinois. As Kathy mentioned, the R&R serves the southern 15 counties, and not just the R&R, but the Southern Illinois region really thinks in terms of our region. We do a lot of things collaboratively because we've had to. And so the work that we're doing with the Innovation Zone is really building on some previous work that we did starting in 2008 with the development of the Southern Illinois Coalition for Children and Families. And that work was done in partnership with the Community Foundation. And the consensus around all the data collection and discovery was that we needed this neutral body. We needed many of the programs in Southern Illinois are housed in larger agencies. Head Starts are either in health departments or in universities or in broader agencies that serve other things. Obviously, a lot of our pre-K programs are in school districts. The R&R here is in a community college. That's the way we've been able to stay in business. And so when we would go to the table to collaborate, we had our hats on from our program, we had our collaborative hat on, but we also had our parent agencies that kind of were in the background saying what's in it for us and how does this fit in with our mission. And so this neutral entity, this central meeting place where all that didn't exist and it was about the children and families that we serve, was really a goal and a vision for the people at the table. In 2010, the bottom fell out of the budget. There was still a huge focus on and desire to do this work. It was like, but everybody went in self-preservation mode, said, I've got to, regroup, I've got to re-engineer my program, I've got to retool and think differently about how I do things. But what was important is that commitment and that spirit of collaboration never went away. And everybody said, we're not going to lose that work, we're just going to put it on hold. And that's really what happened when the Innovation Zone came knocking at our door, or the opportunity for the Innovation Zone. So we didn't redo all that work, and that was a really important lesson to learn because you had a lot of people at the table who wants to do the same thing over and over again. So we pulled out that work. We did refresh our data. We made sure our baseline information was new and current. Some of the discovery process took different, and we decided that while the coalition serves all 15 counties, with the Innovation Zone, we have an opportunity to focus on one county, Williamson County, which many people felt was a strange choice. But the reason we picked Williamson County is it's very diverse and it's a county of haves and have-nots. It's a county that has an ample supply of, for instance, pre-K and Head Start slots, but slots either aren't being used by the children that need to be in those slots, or for instance, in one community, we Head Start, we know in that community there's high needs, but Head Start had to close because they couldn't get children enrolled and they couldn't fill their slots. So we knew that there was a disconnect between how we reach the children that need to be in those programs and getting in those programs. We also know that we had a really good infrastructure and capacity to do the work. Leah talked about, looking at need. We've got high need. We've got strong commitment to quality. We have 5 accredited programs in Williamson County. Then we've got programs that have never even taken the first step in the old QRS system, let alone accelerate. We've got that history of collaboration. And we also, another important strength that we felt would lead to success with this Innovation Zone is that we had a long-term stability of leadership, but some new leaders coming up. And that was really important, so people could really hit the ground running. So as we started this work, we really built on the previous work. We moved forward with we will do this work regardless whether or not there's any funding attached. And that was really important to the decision-making process and how the group moved forward. They wanted to make sure we made sure it was aligned with the coalition's mission and bigger goals. And we wanted to pilot in Williamson County, but always kept this regional vision in mind, which is, okay, we want it to succeed here, but we do want to expand this work to the next county or to this next community. We wanted to build on the strengths and the previous successes, refining the existing systems we had and infrastructures, not pushing things away, not throwing things away, but building and refining and retooling. Utilize existing committee structures wherever we can, and I'm sure most of the people on this phone have many, many meetings, and we talked about, not creating another meeting, but creating another agenda item on a current meeting, and that's been really important to our success. Utilizing existing resources wherever we can, even if we had to redesign them and reframe them, and that we wanted to be really forward-thinking, not doing the things that just as we've done them before, but really preparing for the future with a real heavy focus on technology and overcoming the barrier of distance, because we are a very rural, actually Williamson County itself has some very rural areas, and the southern Illinois region is very rural in its nature. So we coupled all our work together, and our innovation zone has a title called Connects for Success. So we're talking about connecting children to high quality programs, connecting teachers to communities of learning, connecting families to information, resources, and services, and then connecting schools and communities to strengthen families. And really are basing our work on the strengthening families principles with the protective factors. Our target populations, Leah's already talked about that. One category we added that was not in the Early Learning Council's list was rurally isolated, and that's been significant for many programs, because we've got some incorporated villages that have 600 people, and there's no busing, there's no public transportation. We know rurally isolated is creating some hardships. So our initiatives include a screening collaborative, just like Leah has said, but we separated that differently from data collection, and we did that intentionally. So we have two initiatives. One is to become an enterprise zone for ASQ. We have started that work, which means we have an ASQ database for the entire county, and all the children who are screened will be put into that database. We actually have worked through all the MOUs and the agreements for data sharing, and those have all been signed. But what was really important here, the lesson learned here, was to meet people where they are and don't expect change too fast. So, for example, Head Start does not use ASQ, but they're going to be putting information in on children and saying that they were screened using this tool on this day, no referral was made. Because our goal is that all the children are screened each year and appropriate referrals made so children are able to access the programs and services they need to succeed in school. So instead of saying, no, 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 you have to use ASQ, no, 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 you have to do it this way, we said, fine. Let's just move forward as long as the child is being screened. In the collaborative, as the collaborative means, they'll be talking about the differences between those screening tools, but we didn't want that to be a barrier for somebody not to participate, and that was an important lesson learned. We actually wrote in about piloting some transportation. That's been postponed for a while because we're not so sure that we can't do some things with the existing transportation structure within the county, and we're looking at current models to do that. It's something that was just very simple, so maybe a lot of people wouldn't think was innovative, but has given us some really great information, is we have done a kindergarten survey for families registering in kindergarten. One of our conversations was, so if Head Start couldn't keep children enrolled in this community and there's no pre-K, and pre-K can't keep kids enrolled, and there's no licensed child care in that community, where are the children? So somebody said, well, one place they all end up is enrolling in kindergarten. So it's a pre-registration. We implemented a survey in partnership with the kindergarten teachers with two really basic questions. Where has your child been before they came here? What types of settings? And they marked any or all. And where do you get information? Where do you rely? What sources do you rely on most to get information? And that is going to help us with some of the implementation of our other pieces of our project. And the data, the results are really different, school district to school district, but probably most surprising, or maybe not surprising to us, but surprising to others, is that the #1 way that parents want to get information is text message on their phone. their choices were newspaper, community websites, radio, television, their child's school, and the number one, emails, newsletters, was text message to my phone. That would be the best way to connect me to information, which really was proven in some other research that was done at University of Notre Dame about connecting with parents with text messaging. The second group of work we did when we talk about connecting to high-quality programs, we want to improve the quality of our programs, and we want to make sure that we're looking at some things to help them sustain that quality. So some of that work is some policy exemptions or policy changes in the CAP program that would allow children in those high-risk populations to have more stable enrollment. It would also mean for the provider you have more stable funding. And it depends on the level of quality. It also is meant to act as an incentive for programs to operate at a higher quality level. We're currently working with DHS on those. We've had to put them on hold a little bit while the budget negotiations are going on. Support for credentials, taking our PDAs, instead of just working on getting people through school, how about the people who've gotten through schools that haven't gotten the credentials they need for their programs to achieve the appropriate circle of quality. And then looking at a regional professional development institute with a policy exemption which would allow child care centers to be closed for that day and count it, if they had 80% participation of staff, counted as an eligible day for the CAP program. And we're currently working on that as well. We wanted that to happen in the fall, and once again, things have kind of been on hold a little bit with DHS between CCMS and the budget. The last really exciting piece for us is developing a technology infrastructure for our professional learning and professional learning community. And with that work, we're working collaboratively with Valerie Krajcik of the 0 to 3 Center for Infants and Toddlers and Sarah Lemoyne, as well as Chip Donahue, who's the Dean of Distance Learning and Continuing Education Director of the TEC Center at Erickson Institute. We're really excited of that because we're going to be able to develop this infrastructure in context with the idea of how are we going to measure our success and changing the way we measure success where it's needed, and how do we evaluate it. So some of the first things that have happened is we've gone ahead and we have a fiber optic line that's going into our building, the Child Care Research and Referral Building, which we have a classroom there that's now going to become the Center for Excellence, so things can actually be filmed and mainstreamed or streamed through computers so people far away can actually see this. We're looking at some distance technology that's relatively inexpensive, so programs could actually be in their program and be connected with a trainer, whether I'm 4 counties away or 2 counties away. We're looking at the use of technology in mentoring and coaching, which is really, really important, and looking at some models that have been really successful at K through 12 in Florida, where they're filming, live streaming model classrooms, and then the teacher at the end of the day is talking about what people saw and what people were able to see. So we're very excited about that work and excited about the capacity and the expertise that's at the table to help us do that work. We're working on a countywide registration or a countywide connector called SI Kids. Parents will be able to sign up their family, sign up their kids. They're going to get discount cards for things in the community that's being supported by the business community, and then we'll get the information to be able to send those texts to connect them either with activities that are happening, things that are happening at the kids' schools or whatever. So we're very excited about that. We're expanding a child development awareness project, successful child development awareness project in our community, as well as building some new infrastructure around family engagement. And in our proposal, we had talked about hiring a family engagement specialist, but we have since gone back to the table, and this goes back to what Leah says about learning and changing and being flexible. We are working with SIU with graduate assistants because we felt as we put the job description together for the family engagement specialist, it was much too big. How could one person do all these things? And we really wanted to measure which strategies were more successful. And so if we could have somebody focus on different pieces of the work and put it in a research context with a graduate student, we felt we would have a better chance of really isolating and seeing where we got the best results. So we're doing 3 pieces. One that is a person that's really about that, connecting the family to resources, some of that family case management work that's needed. They'll be working primarily with child care centers and people who don't have that capacity to do that work. We'll have another person that's really working on family engagement from a community context. It could be community events, it could be parent nets, it could be parent training. There'll be lots of things that person will be working. And the third, which we're really excited with, is the school district will be actually developing, Heron School District, Northside School, will be working with their teachers to develop some strategies that reach out strategically into the early childhood community. Instead of us building the bridge for transition, it's the school that will be building the bridge and help with those transitions and building the relationship. But they're excited about the opportunity, and we're excited about their leadership. So our successes, our big wins, I think, have been accessing the expertise that we've had, the structure, using the existing structures that mean that there's leadership all in different levels and coming from different programs and different agencies, not just spearheaded by one group or organization. The number of participants that we have had from the beginning that have stayed, we started this work in late February, I guess a year ago, and we have 35 people and groups, organizations that have stayed with us since the beginning. That are still at the table and still actively involved, and still have new people coming to the table all the time. Lessons learned for us has been involvement of any kind is involvement and important. That sometimes we measure it by what we think is successful or committed, but what we've noticed is we've had some people sitting on the peripheral, but they've been a little bit involved, and now they're very involved. Some people were very involved, and because of personal issues or agency issues or program issues or other things they've had to pull out a little bit, we still value that involvement. That involvement is involvement, and it's important. That we've seen a difference in planning for collaboration, and I'm sure everybody on this phone can understand the statement. There's a difference when you plan for collaboration when you actually do collaboration. It's easy to say, yes, I can give this up, until you're at the table and you really have to give up some ownership and you have to put things on the table. And that's been not surprising, but has stalled us a little bit at different junctures, but we've been able to overcome it and come out stronger. That a written timetable is really critical. It's what keeps us all moving along. Where did we say we were going to be? It is not our Bible. It is not our end-all, but it helps us keep moving forward and not get stalled. That everything always takes a little longer than we think, and that we should expect the unexpected. And don't be afraid to change that course if needed to meet our destination goal. That's it.
Thank you, Lori. That was really great. I'm going to turn it over to Janice now, and then let Janice share about her innovation zone. So I'm going to move it to this one right here so she can talk about Greater East St. Louis area. Thank you.
Good afternoon, everybody. As Leah said, I'm Janice Minster, and I do work for Children's Home and Aid. However, the work that I'm doing with the Greater East St. Louis Innovation Zone is actually in collaboration and in partnership with the Greater East St. Louis Early Learning Partnership, which is an organization or a collaborative within the community that is just the beginning entry point of the pipeline of Ready by 21 collective impact work that is happening in Greater East St. Louis. So the slide that you see in front of you shows the geography of Greater East St. Louis. On the west side of zip code 62201 is St. Louis. So we're very close to a metropolitan community. There are 5 zip codes in the geography that we are serving within our innovation zone. And within that geography, it's about 12 mile by 12 miles. So it's not very wide or very deep. And most of the residents, what we've learned through data discovery is that the majority of the residents in East St. Louis actually reside in zip codes 62201 and 05, yet the majority of the residents reside in the other zip codes. So access to programs is not as easy and convenient, and that was something we learned as part of our data discovery process. There's a high concentration of poverty and deep poverty in the community. There are 5,000 children under the age of 5 that reside in the community. Unemployment rate is at 16%, which is extremely high as well. In the community, there are 15 child care centers, 1 Head Start agency, 2 Preschool for All programs, one through the school district, the other through a community-based organization. And then we have about 90 family child care homes. So large capacity for the number of residents in the community. Yet the majority of the children in the community are being served by family, friend, and neighbor care providers, predominantly because they're not eligible for the CAP program because they're not working or going to school. So that's just a little kind of overview of what the population and geography looks like. Our 2 priority populations that we selected for the Innovation Zone are children and families in poverty and deep poverty. And so we often forget, what does that look like? What is the income for a family living in poverty and deep poverty? So I included that information for all of you. And you can see that 50% of the population is at 100%, 32% is at 50% of the federal poverty level, and then 75% of all children under the age of 5 are eligible for child care assistance, so at 185% of the federal poverty level. Yet families aren't accessing the service, again, because they're not working or going to school. The other priority population we selected was that children with disabilities are presently not being served because they've not been screened or have no diagnostic tests being done, so we don't know. But when we looked at the data, and we look at the number of children in the community with an IEP or an IFSP or receiving services through early intervention, it's less than 1% of the population that are getting any kind of supports or services through special education. So we know that in our community we want to take a 2-generational approach, and the next slide shows the strategy for our screening and outreach. The top of it is our goal that we want to develop a community-wide systemic approach to increase awareness, access, and utilization of developmental screenings for children 0 to 3 and 3 to 5. So this is our logic model that talks about some of the work we will be doing. On the right side, we're looking at bringing a consultant to kind of lead and guide and facilitate the discussion about what does the community-wide screening process look like, what are some of the protocols that we would use. We've done some preliminary work on this by doing a Survey Monkey. There are 31 agencies that do some type of developmental screening in the community, and so we just did a Survey Monkey, and currently 23 of those programs have completed the survey, and from that we know that the 3 most common tools being used in the community are the ASQ, Denver, and Brigance. 75% of the population of the respondents said that they would use the ASQ if training and supports were provided. So that's good to know. Once we identify a tool, we would need to build in some supports around professional development, hopefully use some of our parent ambassadors to support the value and benefits of having children screened, not to discover deficits, but to affirm and validate the good parenting and work that they're already doing with their children. And then another piece of our work is going to be looking at data collection. We're hoping if we become an ASQ enterprise zone as well, that we will have one central data collection site, and then we'll be able to use that information for further planning. The next slide is the quality work group that we have going on. That's the other area where we felt we could have the greatest impact because of the number of programs in the community, the spaces where children are being served, as well as the numbers of programs participating in the Accelerate program. So we know we need to generate some excitement and enthusiasm for that process, and so we're hoping to accomplish that through a professional learning community and coaching, as well as providing some supports through mini grants and other incentives. We also are exploring some possibilities with some policy waivers for the Child Care Assistance Program to serve more children in those programs, coming up with some innovative approaches to engage adults in their learning themselves through some cohorts through the colleges and the community college. The next slide kind of gives some snapshot of some of the small and big wins to date. So the first one was a parent cafe that we did early on in our planning process, where we had about 20 parents from the community along with 20 other social service agencies, and we learned a lot through that process about parents' wishes, hopes, and dreams for their children, as well as identifying gaps and access issues in the community. So that certainly helped shape our planning process with the Innovation Zone. Another example is recently the school district was promoting their Preschool for All screenings. Parents were concerned about it, didn't want to take their children there because they didn't want to enroll their children, but indeed wanted to have their children screened for their development. And so some minor language changes, text changes were made in the flyer to state that it was free, that it was open to parents and foster parents, just to find out how their child was developing typically. So that was a quick win for us as well. Because of many of the meetings and stakeholders that we have had, we feel like the community is better positioned than ever because of the new and existing relationships that have been established around the table and during meetings that we've hosted so far. And then we've had interest by funders, 2 different foundations, and a private funder is interested in funding and supporting both the quality work and the screening and outreach work, because we already have a plan and we have a vision of where we would like to take our work. The next slide talks about some lessons learned so far. Is we're so used to working in silos, so appreciating the process has been an interesting lesson learned, and reminding people about what that process is, coming to consensus about how decisions are made, and really taking time to reflect. One of the beauties of the Innovation Zone is we do have the opportunity to learn from some of our lessons. So they're not mistakes, but they're new lessons, new learnings for us. So we use that to think differently, to plan differently, to strategize, and try some other interventions that we may have not tried before. Because most of our work is cross-sector, so you have health and mental health and private funders there, government there, coming together and really clarifying our language, using shared vocabulary, people being able to say, well, what do you mean by screening? What is your definition of assessment? Has been really critical to us having good understanding of what we're conveying and what we're communicating, so that we have some shared language. Multiple ways to engage. As Lori has said, there are people who follow, people who provide work behind the scenes, people who do in-between work, between meetings, completing Survey Monkeys, any level of engagement. We appreciate, and so we do provide different ways to become involved, doing small tasks on the side, completing a survey, gathering data. There's different ways and different strengths that people bring to the work, so we try to capitalize on that when we can. Data collection, what we've known is that sometimes you really have to use the data and create a safe and transparent setting for discussions about data to occur. Our natural tendency many times is to protect or defend the data, because sometimes the data does not look like we would like it to, and so then we have to have real frank and honest conversations about how do we change the trajectory of the data, and those can happen best when there's safety, confidentiality, and a willingness to share. So we've really tried to create safe spaces for all of our stakeholders to come together to have those critical conversations. And then, of course, we've learned some unintended consequences. The first plan that we wrote, we included a new model about a parent ambassador and a CFC coordinator doing some home visits together. Hadn't really thought a lot about the HIPAA laws, so now we're kind of back to the drawing board about how can we meet HIPAA, yet also provide the innovative idea that the parents brought forward to our group. So we're learning from these unintended consequences. And then probably the biggest lesson learned is you got to use the connections. And so sometimes that connection is not the champion in the group. It's because they know somebody who's their pastor, or they have a relative in the community, or they already have a relationship with that person. So you have to use your messengers very strategically to get to the outcomes that you had intended and planned for. So I think that's all I have to share. So I'm curious about questions that people might have for any of us.
All right, this is Kathy. I don't have any questions on the dock. We're just at 2 o'clock, but Lori and Janice and Leah have a few extra minutes. And so if there are questions that people have, you can raise your hand and I can unmute you and you can ask. Or you can ask a question. Lori, there was one question. Oh, wait, something new has just come in. There was a question about leadership in the innovation zones. So Janice and Leah, I wonder if you can both explain kind of what your position is, and then also the leadership, maybe just describe a little bit about the kind of the core leaders or the people you're really relying on in your innovation zone.
Did you want me to answer first?
Sure.
Okay, I wasn't sure. Well, the R&R is providing kind of the back door, the background facilitation work, kind of the legwork of some of the work, but the screening, each committee is led by a leader who is not within the R&R structure. So for instance, the screening collaboration, it is a pre-K coordinator and a consultant that's doing that work. The Council on Equality Early Childhood Workforce, that is a group that is facilitated by someone from higher ed, as well as a program director, and so some of the infrastructure work on the professional development system. So we have 4 committees or subcommittees that are working on the implementation of this, and each one of those groups has their own leadership. The R&R provides kind of the clerical support. We provide space for meetings if needed. Sometimes the meetings are not here, and things like that. But we kind of are the coordinating body, but we by no means are just the leadership group. We are kind of the engine that keeps everybody moving, but we've got engineers on each of those committees that really lead the work and keep people on track.
And for Greater East St. Louis, the Resource and Referral also serves as the backbone organization. And then we have the Executive Committee of the Greater East St. Louis Early Learning Partnership as our check-in and support. And then we have 2 committees, the Screening and Outreach, which is co-chaired by someone from Early Intervention and StarNet. And our Quality Committee is co-chaired by a social service agency that provides prevention initiative, Preschool for All, Head Start, and child care services. And we have a Head Start individual who's also a co-chair. And then in between meetings, work group members sign up to take on task, and they do in between work and then report it at the next meeting.
Thanks, Janice. I see that Lannon Broughton has his hand raised. Lannon, I'm going to unmute you, and if you want to ask your question. Lannon, do you have a question? All right. Sometimes I know that we all accidentally raise our hands. It's 2:04, so I'm going to be respectful of people's time and wrap up. Let me just really quickly just show you. I want to make sure that people have Leah's contact information. If you want some more, if you have questions about the innovation zones that that we were not able to answer, please don't hesitate to contact Leah. Am I right, Leah? I hope.
That's good. Mm-hmm.
Okay, sorry about that. Okay, so I'm just going to wrap up with just a few quick things. So here's Leah's email address. Sorry. At Action for Children. And also want to direct your attention to the Partner Plan Act website where materials from today are housed. We are also working on incorporating more from the innovation zones on that website, so that'll be kind of your go-to resource. I want to launch one last poll. There were some topics that were raised today that or some concepts that may be of interest. The consortium is really interested in trying to bring different ideas and training to folks, and so we're just kind of curious if there were things, and if there's something that you heard today. I know Leah also brought up the names of a lot of books and other resources. If there are things that stuck out to you that you want to learn more about, fill out this poll, or also send us something in the chat box. I'd like to know more about Art of the Start, or I'd like to know more about negotiation. You know, we're really interested in knowing what folks are interested in. Okay, so here we go. Of course, family engagement strategies. That that seems to be a common theme among all of us. And we have a lot of people also interested in learning more about data-driven discovery. So wonderful. Thank you so much. I really want to, again, thank Leah and Janice and Lori for presenting today. You guys are doing amazing work. I don't know how you sleep and how you do your other jobs in addition to the great work you're leading in the Innovation Zone. So thank you so much for taking time, and thanks to all of you who participated in today's webinar. We really appreciate your ongoing interest and, of course, all of the work and leadership in the field. Have a great afternoon, and stay tuned for more webinars from the Consortium for Community Systems Development.